Hello, I'm Gerry Mobbs, clinical psychologist. I wanted to share with you today a technique for managing panic attacks. So panic is when we experience intense anxiety, and there's usually strong physical sensations. People have difficulty breathing. It's when anxiety really peaks, our breathing changes, and we usually experience a whole lot of other physical sensations. We may have tingling in the fingers and the toes, sweating, our vision may go blurry, we may feel numb, we may feel like we're going to faint, and then there's a whole lot of other cognitive experiences that go on too. People often may think that they're dying, or that something really serious is happening, or they're having a heart attack. So I wanted to just talk with you about panic, because what panic is about the body's protective fight or flight mechanism. And it's about when the brain perceives a threat, and then the fight or flight response kicks in as a way of protecting the body. So the fight or flight response is our survival response that we've had since caveman days. And so when we perceived a threat back then, usually in the form of a saber-toothed tiger or something of the like, the brain had to say, okay, there's a threat here, what are we going to do? We're going to either fight, we've got to attack this animal, we've got to protect ourselves, or flight, we've got to get out of here, we've got to run. People often say that there's a third response, which can be a freeze response too. So the problem is nowadays we don't have those sorts of threats, and usually when we're experiencing panic, our warning system is out of whack. It's gone into overload, and it's perceiving threats that aren't actually a threat to ourselves. And then the body's fight or flight response kicks in. So one of the most powerful things we can do to manage panic is about our breathing. Over-breathing, breathing too quickly, and breathing up in the chest, often usually breathing in through the mouth, that can cause and maintain panic. Because as long as our body is still over-breathing, we're still sending messages to the brain, there's a threat, we've got to keep on this fight or flight response here, and the body will keep panicking. So you may have a panic attack for no particular trigger or reason, but if you do, if you can stop and slow down the breathing, it can turn around that whole stress response and start to trigger a new relaxation response, which is actually about slowing down the body. So the way that we do that is that we want to get the breath slow and deep and down into the belly, away from up in the chest and over breathing. We want to get it right down deep in the belly and nice and slow. And that's one of the most powerful things we can do. So I want to show you that right now. So wherever you are, if you can sit, just put your hands on the belly. Now you can have your eyes open or closed. And first of all, I want you to just become aware of the fact that you're breathing. And feel your belly beneath your hands. Just notice the belly moving underneath your hands. And now breathe in through your nose, and then all the way out through the mouth. Breathing in through the nose, and all the way out through the mouth. Let yourself take a nice full breath in through the nose. And then on the out breath, let go slow and long and deep. Then just notice how the lungs automatically know how to refill. You don't have to try too hard. And now as you breathe in, push your belly out. And as you breathe out, just let it fall back down. As you breathe in, push your belly out and up. And as you breathe out, just let it fall back down. It's like there's a balloon in your belly, and as you're breathing in, blow the balloon up. And as you're breathing out, just let it fall back down. Breathing in, blowing the balloon up, pushing the belly out, and breathing out, just letting it fall back down. I'll just pause there for a second and check how that feels. Sometimes that can feel quite strange and the opposite of what you normally do, or sometimes you can feel a little bit lightheaded. That usually is a sign that you are doing that over breathing with panic, and that you need to learn this practice of doing the belly breathing. So even if it feels a bit uncomfortable, keep practicing it, because it will get easier with time. If your stomach feels quite tight and rigid, that's okay. That just means you've got to learn how to do the belly breathing until you will be able to see some movement and really feel that movement. We'll practice together now for a few minutes doing some counting. And the purpose of the counting is just to slow down and to get the out breath longer than the in breath, to stop that over breathing. Because when we're over breathing, we're trying to get the next breath in quicker than we actually need to. So if we force ourselves to make the out breath longer, it slows down that cycle. So we'll continue this for a few minutes together, and we'll breathe in for 3 and out for 4. So again, just putting your hands on your belly and breathing in through the nose and all the way out through the mouth. And breathing in through the nose and all the way out through the mouth. And as you breathe in, push the belly out. And as you breathe out, just let it fall back down. Breathing in, pushing the belly out, filling that balloon. And breathing out, letting it fall back down. Breathing in, 2, 3, out, 2, 3, 4. In, 2, 3, out, 2, 3, 4. In, 2, 3, out, 2, 3, 4. In and out. And in and out. And in and out. And in and out. In and out. That's great. Just keep breathing like that. Feel yourself slowing down and settle into it. You don't need to try too hard. Each time you breathe in, breathing in calm, fresh air. And each time you breathe out, releasing and letting go of the body. Feel your body slowing down. We'll just finish the practice there. That's great. So that's belly breathing. A good idea if you are experiencing panic is to practice that breathing a couple of times a day, 2 or 3 times a day, even when you're not necessarily feeling anxious. It's like going to the gym, building up your muscles. This is about learning this skill and building up this practice. So you can practice it even with your meals as you sit down for breakfast, lunch, dinner, or associate it with some other thing in the day that you're doing. Just 5 minutes or so of slow breathing. And then you can use it then in those moments of panic. All the best with that. And you can find out more information about me on my website, gerrymobbs.com.au, on YouTube and podcasts on Podomatic and on LinkedIn.